Now, this story, the Health Minister, Dr. Joe Phaahla, is considering ending the wearing of face masks as COVID-19 infections flatline. In a letter doing the rounds, Phaahla is asking provincial MECs for their views on whether the country should do away with its COVID-19 regulations. Many have been calling for this. There's also the matter of the loan from the World Bank that's just been approved, which, according to government, is for the procurement of 47 million COVID-19 vaccine doses. Well, let's discuss some of these developments with health economist, Professor Alex van der Heewe. He's from Wits University. Prof, thank you for your time, and also thank you very much for your patience while we were still downtown Johannesburg covering the march and of the residents from Soweto in that meeting with the mayor, Dr. Mpho Phalatse. I've seen the copy of this letter that Dr. Joe Phaahla has sent, dated the 20th of June. I would assume you might have had a look at it as well. Basically, it's a consultation process for the recommendations. Main among the recommendations is to stop mask wearing, to stop the limitations on gatherings and entry limitations. Is it time?
Yes, it's actually been time for quite a few months. It's been very clear that the sort of incidence of severe illness resulting from COVID infections is very low, and that's due to an accumulated immunity within South Africa to severe illness. It doesn't mean people don't get infected. It just means that fewer people get severely ill and die. So the rationale for a kind of general emergency footing has long gone. And the current restrictions in place themselves are probably of minimal value in preventing transmission in any case. So I think that it's really about time to remove them. The other issue is that universities, for instance, and a lot of organizations need to go back to being able to have full capacity in their organizations where necessary. So the social distancing requirements, which are now probably an ineffectual hindrance to sort of normal functioning, should stop. But probably people who still are vulnerable to infection or who are themselves infected should continue to wear masks in high-risk places, but it will largely be a voluntary act, depending on how people perceive the sort of relevant risk. Yeah. Noting, of course, that the quality of the mask is important.
The quality of the mask, yeah. I mean, I see, and I'm just looking at the letter, the minister, Dr. Phaahla, saying that the recommendations are going to be discussed with cabinet in the next 48 to 72 hours. Normally, the South African cabinet tends to meet on a Wednesday, so we are waiting to see what's gonna happen tomorrow. I think it's important to note that in the letter he says they've been monitoring the epidemic, working with the NICD, and they've got some epidemiological analysis to make these recommendations, and with a decline in numbers as well and in the severity of illness. Just wondering why they would have taken so long to get here. Have you got some insights, Prof?
No, I mean, it appears that there was an excess of caution. They're indicating that the reason that they were so cautious was because there was a rise in the number of infections as we moved into winter. But in fact, the sort of rise was relatively short-lived by comparison to previous waves. But it's also quite likely that a lot of people aren't being tested. They're not coming forward for tests, and we're just treating any infection as a kind of flu infection or a cold. And so the actual tracking has probably gone down quite considerably. But the main issue is severe illness and death. And the severe illness and death is just not showing in the numbers. And that has been the case for quite a while since the previous wave into the current wave. So yeah. I think that it was just an excess of caution and probably unnecessary. And quite a lot of people have indicated that we could have moved back to normality already.
Yeah, as you mentioned, I mean, the numbers have gone down. The letter, Dr. Phaahla says there's been a decline in the number of reported cases, as you say, the number of hospitalizations, the positivity rate has declined, and there's also a decline in reported deaths. But you've made a point I want to go back to, Prof, that whatever the outcome, we're going to have to wait and see what happens within the next 72 hours, counting from yesterday, so over the next 3 days, and the cabinet meeting tomorrow with the National Coronavirus Command Council having these recommendations now taking to cabinet. You've made a point about the wearing of masks and the quality of masks for those people who are vulnerable. Who would likely fall into the category of being vulnerable?
So because it's now endemic, the issue is that the virus hasn't gone away. It's become endemic. It's going to be with us forever. And so we're probably all going to be infected multiple times over the next, for the rest of our lives, quite possibly. But so somebody who's vulnerable and gets infected because people are now interacting normally may still be at risk if they've got a compromised immune system. In other words, diabetics, people with cancer, and some people with cancer might not know they have it, and people with hypertension. So a lot of those kinds of conditions increase your vulnerability to severe infection and possible death. So to the extent that somebody is feeling vulnerable for those reasons, and in many cases people are aware of their diagnosis, they should be wary about certainly periods of high infection and wear masks in crowded places. But the issue of the quality of the mask is important. Probably a surgical mask is not adequate protection. So an N95 type mask that is close fitting around the face would be very important. There's no point in wearing a cloth mask or something that allows air inside or blows air out. That's not adequate. So if you're vulnerable, protect yourself. The other issue is that people who avoided any infection over the past few years and haven't been vaccinated essentially could face the same risk of a severe illness and death as you would have in February, March of 2020. So now everybody going back to normal hasn't removed the risk for those people. Okay. So the issue is, if you're in that situation, you do need to get vaccinated if you want to reduce your risk.
Thank you very much for your insights. That's a health economist, Professor Alex van der here from Wits University. As we await to hear from Cabinet whether or not the days of mask wearing are gone and that you can attend any gathering of any size. We'll have to wait for that announcement in the next few days. Still